episode of ASAP Conversations. And as you all know by now, the conversation we started as a way to sort of understand the current situation when the global pandemic has sort of hit all countries around the world, affected partners and communities that we work with. So we inviting guests who are partners, who have worked with us, who have attended our institutes to talk to us about the situations in their respective countries and with the communities that they work with, and specifically how the COVID-19 has affected it even more, like there, and specifically how it has affected SRHR and abortion services. But we'll also talk about much more than that. And so today I have with me Rola, and I'm very happy to have this conversation with her. So thank you, Rola, for joining us. If you could introduce yourself.
Okay. First of all, thanks for having me. My name is Rola Yasmine. I'm from Beirut. I live here in Lebanon. I work on the A project, Mashra al-Alif, which is an organization that works on sexuality and gender, body politics, particularly combating medical patriarchy through reclaiming knowledge and medical sciences about our bodies, with a particular obvious interest in sexual and reproductive health and rights, as well as in mental health. So I'm a nurse by training and practice, and what we do I consider community health nursing. And I've studied sexual reproductive health research, so I have dabbled in research as well. Been a partner, friend, member of Asia Safe Abortion Partnership for nearing 10 years, maybe. I think so. And so I'm very happy to be part of these conversations as well.
Thanks, Rola. So I think, I mean, yeah, you wear many hats, we all know. So, so thank you for sort of joining us and making time for this, because I think it's very important to sort of get a bigger picture of what's happening in the world, which otherwise a lot of the times the mainstream media misses out. So my first question to you is basically if you can take us through the situation in your country and the region, and what were the issues even before the pandemic hit you.
I think it's a bit exceptional what's happened here. I mean the pandemic and virus obviously feels exceptional globally, but I think what kind of came as a double hit is that we have been going through a lot of like a very uphill battle with the government on massive corruptions, on state basically condoned like theft for private and public figures. Lots of money has been ripped out, and now we are kind of facing like a financial crisis, massive crisis. So yeah, so we've been so since mid-March, and even before that, things weren't doing very well economically. So a lot of people are fired from their jobs. A lot of people have been given half salaries. There's a lot of nurses that are complaining that, especially even now during this medical warfare that's happening, this like health problem, that even their salaries are getting sliced in half, which is unimaginable in this time also ever, but specifically even now. So it's been really hard in that regard. If particularly also thinking about migrants, a lot of embassies have asked migrants if they want to leave to go home, particularly migrant domestic workers. And the situation of like violence, not only domestic violence as we know, but also violence against migrant domestic workers is increasing. It's just to say that it's been I think it's just been a series of really bad things, to say that in a polite way. So it's people are hungry, and a lot of people have lost their jobs, and I think that only reaffirms the need to protest the powers that be and the situation of impoverishment that they're forcing on particular people who are, or from like a working class um, or non-Lebanese. Very
mm,
particular measures are happening on
mm,
those.
mm. Right.
Yeah,
So you've actually brought me to my next question, which is related to this overarching sort of question on what are these issues that are probably, really important right now to the feminist movement. Of course, the larger economy and the austerity steps, all of those, because they are affecting everything. But
yeah,
particularly looking at, the kind of, work we are involved in, the SRHR and the abortion rights issue, and you've already touched upon it, and therefore my logical sort of progression is to this, that what are the current sort of or what were the issues even before the pandemic, and what do you see has changed or maybe even amplified and aggravated because of the pandemic. So these, some of these overarching issues that you've talked about for migrants, for refugees. So if you can just speak a little bit on that.
yeah. Yeah, I mean, it's sad to think that, before, I think a lot of women found it hard to be able to access SRH services, particularly thinking about refugee women who have children, who feel like, where do I put my kids? Most healthcare facilities don't allow for children to be there, especially ones that are subsidized or free of charge. And so and truly, again, like, you cannot rip sexual reproductive health care from domestic labor. And so if you don't know where to put your kids, you can't go get sexual reproductive health care. Like,
Mm,
it's
linked.
sounds pretty, people will say, no, why don't you just put
Hmm.
them somewhere. It's like, no, like, kids actually need to be taken care of, and they need somebody with them, and you can't just, some women have said, I've had to lock my kids in the house and leave, like, quickly. So, and that's really upsetting, to have to force women to practice a motherhood they don't believe in, just because systems can't really accommodate the realities that, particularly for women who aren't not from here, you don't have systems of support, or sisterhood solidarity networks as massive as if you grew up here, right? A lot of healthcare clinics closed down
Hmm.
just like that, and
Hmm.
that doesn't make sense. Like,
Hmm.
surely there are more health issues than COVID
Hmm.
happening,
Hmm.
and everything else seen as secondary to that. And
Hmm.
that's, especially, I think, if we're thinking about unwanted pregnancies, there's a time limit on that. And not like a time limit in terms of, like, oh, what gestational age, is it okay to terminate or not? No, more about, like, socially speaking,
Hmm.
religiously speaking, there's, for a lot of people, just like, they're probably really okay with having an abortion, but up until a certain time, they're not. And so, and for a lot of providers, they don't mind up until a certain time, even though it's legally restricted. So, if you shut everything down, where women cannot seek access to care, and then they prolong uh, the time where they have to find that care, then they're going to find themselves in a problem of, like, maybe
Hmm.
like a second trimester termination that nobody wants to do, and then we would worry about whether there's an increase in unsafe abortions. Now, the problem is, right now, none of that is present or obvious. It's too soon, I would say, to find out, but it is something that we have to keep our eyes open for. um there's, I mean, and it's not so much, I mean, the fact there's, like, limited imports and stuff affects healthcare items, or
Hmm.
needs and products. But also, I think the fact that, the currency is, the Lebanese currency is pretty much screwed at this point. Like,
Hmm.
it's
Hmm.
condoms have kind of increased maybe threefolds in price. Makes
Hmm.
no sense. It's
Hmm.
basically, like, now it's around, like, a condom for maybe $4 or $5.
Hmm.
It's,
Hmm.
people are not going to use condoms. That's just not
Hmm.
going to happen.
Hmm.
It's already hard to convince people that, condoms are useful,
Hmm.
because of because
Yeah.
of what people feel about condoms. And now it's like, oh, you're gonna make it harder to convince that by making it so expensive.
Yeah,
So it's not going to
that's
be an essential thing to use as well.
that's ridiculously expensive.
Oh yeah. No, it's people people are putting really funny things on the internet though. I mean, the internet, you gotta give it to the internet. Take a situation and make it funny, but it's still pretty sad. You
I
know,
can.
yeah, but people put, like a pack of condoms, costing that much, and they're like, what is that? And there was a joke, and I laughed for days, but now I can't remember it anymore. But yeah, I really think that there's like a lot that's happening in terms of like these, obviously how the economy is affecting sexual reproductive health, and how, I think it's really, it's really wrong to close down clinics in a time like this.
Yeah. So I just wanted to like two things that you just said. One is that like the government doesn't provide these services. Like if you can just so is it not available in public facilities, and do people have to then go to private facilities and pay for these services? And the next,
Basically, I mean, it's a married unmarried thing, but yeah,
okay.
sorry, gone.
No, no,
Yeah.
the other thing I was talking about was the availability then. Like, are these services, like, even, and also, like, say, contraceptives, condoms, MA pills, say, even if the prices have gone up, are they even available anymore? Like, what are the, so these two
For
things I just
for
wanted to.
now, it's my understanding that things are available but expensive. I don't think that anything's run out in that realm yet.
Hmm.
At the same time, these aren't things that are provided for. You don't have youth sexual health clinics. You don't have, clinics that are particularly friendly for women or for like queer or trans folk. That is part of the public system. Obviously, there are some private like initiatives, right?
Hmm.
Um, but publicly, the family planning centers are, you know, catering for married women.
Okay.
And to be honest, like I will also question how much it does cater in
Hmm.
terms of like its reachability to women who need those services. Um, the healthcare system here is mostly like, there's a high level of reliance on private healthcare.
Right.
Um, whether, like very expensive or cheaper,
Hmm.
you can find pretty much all kinds of costs within private
Hmm.
healthcare, but private is like a big one. And public is when you're thinking about like, national like social, like the welfare system, like part of like your job,
Hmm.
you would have like a security fund, part of
Hmm.
the security fund that you already
Hmm.
pay for in your labor and that your employer pays for
Hmm.
as well. That's a pretty strong public healthcare system actually. That is really good, I think, for surgeries, for covering a lot of things. If you have that, I think that's pretty good. There is a fear.
Hmm.
11. Could you? There is a fear that actually came out of nowhere.
I'm sure this video will go viral, so let's continue.
There is a fear though that the NSSF, which is the National Social Security Fund, is also going to tank, or that it's going to be at risk. She's now just rubbing her face on my lap. And the reason why there is that fear is because of the corruption that I was talking about earlier,
Hmm.
where so many government politicians and state like politicians have robbed the country blind so much that
Hmm.
there is a question. Okay, all that money that's been accumulating in that security fund, that social security fund, is it still there? Can it still cover a lot of things? For now, I think it doesn't look like it's going to stop anytime soon, but there is, I think, some fear about end of service payment, like a pension.
Hmm.
Um, so, so the public healthcare system works a lot in that if you're part of
Hmm.
that fund,
Hmm.
or part of like co-op funds.
Hmm.
But other than that, I would say a lot of people go to private health.
Private.
And I
Right.
would say that if you don't belong within all the kinds of like norms, so you're unmarried, if you're queer, if you're trans, if you're, if you're particular, so migrants, you don't fit,
Hmm.
right? Like refugees, unless you're registered with UNHCR or you're registered with UNRWA, the UN bodies for like refugees,
Hmm.
in particular for Palestinian refugees.
Hmm.
Um, So unless you are, you can also get those services. But even if you are registered there, if you're unmarried Syrian or Palestinian woman, you're not going to go to those services also, because there is like a
Mm.
macro structure that is an acceptable way to take public funds. And if you're a bad woman, you have to pay
Right,
for it,
right,
literally at this point.
right.
You and I were talking
Mm.
earlier, this happened in Poland.
Mm.
They're trying to push to kill the abortion
Yeah,
legalization bill over
yeah,
there.
yeah,
Um,
yeah.
which is really quite something to say that this is that they would take this time. I don't know where I read somewhere else that there's like the gender legal gender recognition also being taken back. I want to say Hungary. I can check.
Hungry. Yeah, we have to,
Yeah,
yeah, we'll check. But so did the US, which many states in the US tried to say that abortion's non-essential, and so to put that on hold from
yeah.
health systems.
It
And
really says something that this is the time, like that's in a time where I think people feel very vulnerable, very scared,
mm,
quite alone, where a lot of people's
mm,
mental health is suffering.
mm,
Where a lot of people are struggling with domestic violence, and
mm,
where all your other health needs are seen as you know sub, substandard to like to COVID. I think a lot of people really are starting to see the reality that this is not a system that works. This is not
mm,
acceptable. That there is not only is there a lack of care or negligence or corruption, but there's an intent to harm. Like it's not only like that they're trying to just get away with what they want to do. No, they're actually trying to actively hurt you in the process to get
mm,
above you,
mm,
And I think that kind of to feel like you're directly attacked that way versus that people are just, you know,
mm,
feeling and doing
mm,
okay in their own corner,
mm,
that you're actually being attacked in that way. I think
mm.
there's a lot of distrust, I think, in the state, a lot more than before. And I think it's
Right.
because it's very obviously trying to kill people.
Right, right, right. I agree with you. And as morbid as that last sentence is, I totally, I totally agree with you. And just to summarize some of these conversations, just for the audiences, and so I think the key takeaways for me, at least, is the fact that whatever Rola is mentioning is, again, I see so many parallels worldwide. Governments taking advantage of the pandemic and crashing, coming down heavily on activists, on protests. That again, it has been a worldwide phenomena. Amnesty has had to step in and talk about, not using this pandemic as a way to increase authoritarian measures. And I think we are at the risk of seeing authoritarian measures rising. And you've got a really cute cat there. Makes me miss mine. So, so
Sorry, she just hates when she's not the center of every.
yeah, and I
Anyway,
wished the center of our worlds were the animals and not us, and
yeah,
we would have probably had a better system in place then. But coming back to these
yeah.
important the coming back to the important discussion that we just had, I think, yeah, so the states must offer public health, which is universal, which is stigma free, and which is accessible. And no pandemic or no crisis is a good enough reason to suspend some of these health facilities. Yeah.
Absolutely. And actually, just to say something, that I think that it's been a little bit more harm than good, like the conversation around like this fake solidarities that like people are, with the hashtag stay at home type thing,
Hmm.
and like,
Hmm.
whatever celebrities think
Hmm.
they're accomplishing. But and the truth is that it's such a like a liberal push,
Hmm.
in the sense that when protests did start rising again in the
Hmm.
north, where a lot of people were they don't have food to eat or to feed their families.
Hmm. Hmm.
A lot of the same people who've been stay at home kind of really comfortable have been saying,
Hmm.
oh, how are they getting together like
Hmm.
this? How can they protest? They're trying to kill us. oh, they're so ignorant, you know, and very like a very classist kind of look at, you know, those people from the same country, right? So it's like it's not saying, oh, this foreigner is, you know, behind, backwards. It's saying, oh, this guy who's poor, they're so uneducated, they're so unintelligent. Look at them. Like you're protesting that you're hungry and that you're dying, but you're taking yourself to the streets and you're killing yourself through catching corona and like spreading that to your family. And I think that there's like a lot of misinformation. Also, I think there's been a lot of like fear mongering and scapegoating. I think that there is something to say about you know, really talking about, you know, how these recommendations on preventions for catching COVID, you know, are quite classist, and they're quite you know, they've got like a very they've very obviously target a certain picture of people, and that it wasn't put in this many ways, like if you can't do
Right.
this, let's do this, let's do this, let's do that. It really kind of came out as one message with this assumption that everyone has good means, and that's something that's really, I think, it really shows that not only are states not supporting with what you were also saying in terms of, you know, we want universal health coverage, we, you know, we want welfare for, you know, unemployment, like,
Yeah.
you know, financial support, you know, stuff
Yeah.
like that. But
Yeah.
we would also hope that, you know, that people, not only a state, can kind of understand that, you know, if somebody's protesting, they also have the right to protest, and you know what, they have the right to get, you know, infected, and you know, that you take these risks. At the end of the day, you explain to people, but at the end of the day, people do what they need to do, and they can measure, you know, the pros and cons of both. Sitting at home afraid of something I can't see or feel, you know, versus sitting at home feeling starved and, you know, seeing that I've let down my family, or that I can't keep them, you know, what are you going to do? Stay there and feel horrible about that, or go out and do something about it?
Absolutely. I think you made some very, very relevant points. And I don't know whether, unfortunately or fortunately, they kind of will resonate with a lot of us across the world. However, one of the things that we were discussing in the team, in the ASAP team, is that every crisis is also a moment for us to sort of end what was happening and restart. So it could be a reboot, restart button. It could be a way to sort of say that the old systems were clearly not working. So let's move and push towards building new systems. So sort of my kind of the wrapping up question to you, like the second last question to you is this, like if there's anything else you want to add, and otherwise I'll just ask you, do you see from this moment, what could be the big takeaways, what could be the big demands, big asks towards changing sort of the system towards going for a transformative changes, and sort of pushing towards the better world, because clearly the
Yeah,
world we left behind pre-COVID was the problem, and COVID kind of came in and amplified it. So
yeah,
your thoughts
yeah.
on that?
I would say that I don't know if COVID, yeah, it just made it clearer somewhere, right?
Clearer, yes.
I think it made it clearer. I think people who were kind of on the edge felt, you know, so that's
Mm,
you know, in terms of like, in terms of into poverty, you know, in terms of like capitalism kind of like keeping you like, you know, paycheck to paycheck, you know, that kind of thing,
mm,
um being unsupported in terms of health and all that. So I think if anything, I know that you know, that the internet is like heavily populated with, you know, we can't go back to normal,
mm,
normal wasn't working, what's the new normal, don't
mm,
say I want things to go back to normal, that's privileged,
mm,
all that stuff. At
mm,
the same time, you know, it makes sense for a lot of people who are like in a very shitty situation, that that normal is better than this shit. You
right.
know, that it's
True, true,
also that it's
true.
also like really easy to kind of pontificate about that. But what I would say is that I think it's very similar, I think, to the way that I kind of understood how things happened in, you know, with this last uprising in October 17th.
Mm,
It's, you know, the question was, what's going to happen after,
mm,
right?
mm,
Um, and I think like it really depends on who you are, right? Like what kind of person you are in terms of you think nothing's going to happen, this stuff leads nowhere, or no, you've got hope that a lot of people are moving things forward, or we need to put down some real steps where we can capture the gains of this movement, or what's happened from this crisis in terms of the corona virus now. To be honest, like I don't know, I'm the kind of person who I don't like to hope too much. I don't like to get disappointed, but I do like to feel really content with where we're at. And I think there's a lot of open eyes. I think there's a lot of realizations that how much doesn't work. I think a lot of people were really disillusioned with capitalism. It's very strange, like you see people online saying, "No, capitalism is great," and you're like, "Don't you understand? Why are you saying that?" But I think for a lot of people, I think the idea of capitalism has always kind of just been, because you live in it. So sometimes you don't even understand what the other possibility might be, and you're not sure you can imagine another way. Why? Why would I? Why would I not pay for my education? It doesn't make sense, right? Because it's really indoctrinated. And I think just like the way that it is now, I read a few things about some people saying, well, if Yale goes online, why do people pay that much for Yale? If you could just, it's on this computer. Like that's what's so brilliant about it. Why do they charge so much? What's wrong with Ivy League schools? I mean, I think the level of the levels, the multi-level of like exposure, or like that people have been busted. Systems have been busted for where they're at, and I don't think you go back from that. So for me, where that takes us, I would say, I guess, I don't think people should imagine, like lockdown is done and they're gonna go out and global warming's moving. It's not happening anymore.
Absolutely.
Like bartering, healthcare for, like, don't imagine, a radical shift in that. But I think there has been a radical shift in perception. And I think that's always, as people who are interested in social change, we know that's the hardest one.
Right.
That's the hardest one to do. You can debate and negotiate with, like, people in power and policy and whatever and all of that, but it's always so hard to implement anything when you get it from the top and you try to trickle it down. It doesn't work like that. So I think I think there's been a shift in perception. At least that's the way that I understand it. And I think that I don't know if I can say the same for very rich people, but I think that that a lot of people have been reading a lot more. There's been a lot of like interesting conversations online and arts, and there's been a lot of people sharing their stories and what they're going with. I think since we're always so busy running from one thing to the other, people who can afford to stay in have, I think, maybe been listening a tad bit more, doing conversations with ASAP. That's really putting a conversation out there. I think I'm definitely more open. I'm listening to more things. I'm making the time. I'm finding that I have more time because I'm not in some on the road or whatever. So I think people, I think there's a shift in perspective coming. And I would hope that we're all like in the right positions to help continue that. That's kind of what we've been waiting for, right? I think there's a lot to say about like transnational solidarities. I think there's something really strange about how this virus says, you're like, how's the same thing happening somewhere else? We always feel very alone in our oppressions in some way, right? And now it's it doesn't feel that way. And I'm not saying this is the positive side of the virus. I'm not an idiot, but but it's definitely something to say that that you've seen like this parallelism across the globe, and particularly across the global south, of how people are talking to each other, and kind of watching the north like, well, not very smart, are we? Like, you're stronger than illness.
The bully bites the dust.
I mean, and once I'll give you a small example, and I mean, basically that's my answer. That like I think there is a shift in perspective. I think there's a lot more to do in terms of transnational solidarity's work. I think we're all kind of like now a bit more in tune of like listening across. We've always had it as a feminist movement,
Yeah.
right? We
Yes.
do a good
Yes.
job talking to each
Yes.
other, but
Yes.
I think this is like kind of upped our game a little bit.
Yes.
And also, I think there's a south to north kind of like, like injecting yourself with a disinfectant is where we saw this going, but not surprised, are we? But also, it's a funny joke. It's
Yeah. Yeah.
okay, but I mean,
Yeah.
obviously, the joke's on on people because
Yeah.
a lot of people are getting hurt, and
Yeah.
that's
Yeah.
unacceptable.
Yeah.
But there is something to say about you know. About how things have been managed in different places,
Yes.
where governments, are arrogant and white
Yes.
and white supremacist.
Yeah.
You
Or
know?
not, no, or brown, but things like a white supremacist, that also.
Yeah, absolutely, absolutely. I think there's just been
Yeah.
people have really been looking
Yeah.
through the numbers of like COVID at different government approaches,
Yeah.
saying, why has New Zealand not been as strict, or why is Sweden not,
Mm.
locking everybody in? And
Mm.
people going like, why are we locked in, by the way? And just questioning that
Mm.
authority, I think,
Mm.
is really smart.
Yes.
And at the same time, I think it's really, it's kind of like opened up these pathways for people to really think about what governance means.
Thank you, Rola. And my final question to you, I know you look at self-care also, or well-being, from a much more radical perspective, in terms of from much more sort of a perspective which is not commercial and not individualistic and all of that, and we've had those conversations with you in the institute. I just, this is something that I want to ask you to sort of leave for the audiences, and so that they can also like sort of wrap up the conversations on a more positive note. Like, what are the things that keeps you going? Because you are dealing with a lot since October 17, the revolution, the crisis, the economy, the refugee, the migrants, and the women, and the issue of, misogyny, which is rampant. How
Yeah.
do you deal with all this, and what are your coping mechanisms? Because I'm sure right
Mm.
now the entire world needs ideas.
I watch Special Victims Unit of Law and Order. Sorry.
You've been talking about it. It must be really good.
First, it was bad good, then it was good good, and now I think it's bad bad. But um, what I'm saying is that I don't have kids. I have that cat you saw. I don't have a responsibility. It's very different, right? It's very different. It's very hard to give advice. I keep seeing these memes. What a great time to not have children. I'm like, I speak to for myself with that one. At the same time, I mean, yeah, I would say, if you've got a partner and, if you've got people to take care of, whether they're children or, older adults, and, all that, like, I would say, like shifting between who takes the weight of things. And it's important, I think. Not, a lot of people now think that everybody's available for conversation. I think a lot of people really want to lean on people because they feel lonely, or there's an existential dread, there's a lot of fear. I would say, don't feel bad to not pick up on like a phone call, and reach out to people, but still maybe understand that that it's very burdensome sometimes to just constantly be like, feel like, oh wait, how did my morning just go? Oh, because I'm doing like emotional support, checking in, and I haven't been able to yet see where I'm at. So just to
Right.
understand that, just because maybe some people are at home doesn't mean that they're always available. Understanding that, that there is a sense of privacy, that people should have their own time, their personal time.
Mm-hmm.
At the same time, I've really enjoyed connecting with people who I really love, but I just never really have the time to connect with, who don't live in the same country, for example. So people who I wouldn't see that often, and so So that's been really nice, I think, to just kind of like, to reflect on that, especially within the feminist movement, like especially like it's the transnational movement.
Mm.
It's like
Mm.
you meet a lot of really cool
Mm.
people, and
Mm.
and it's like in that time and space, and you do something really nice, but then you don't kind of go back to it. So it's been really nice to hear from them, to
Mm.
read from what people are writing on what's
Mm.
happening in different places, but also to just check in. And I think somewhere that's felt like, like maybe these are real friendships.
Yeah.
It's because so I think that I would say, I guess, invest in friendships in that regard, because I
Yeah.
think friendships are really radical,
Right.
strong,
Right.
stronger than families, and they
Right.
make families themselves. And I would say that this is the time to do it, but also go easy on your friends. It's
Right.
not an easy time, so maybe to practice that kind of like patience, and knowing how to shift your burdens, and to take some, I
Right.
think, in that respect, I would say that's been really useful for me.